Hello, everybody. How are you doing? I had to think about what I was gonna ask there for a minute. It is December 10th, and this is NuPath Live. We're excited today, actually, because this is our first time that we are pushing this broadcast out to Facebook Live and to YouTube Live. So anybody that wants to watch it there should be notified, or you'll be able to do that there. That obviously goes beyond my technical skills. A lot going on, and I'm glad you could join us today and to hear updates on some of the things that have happened in the news lately, and to try to make some sense of it, and to see how it affects this organization and how it's going to be affecting our staff and families in some cases. But let's start with, well, we did this last week. I asked you if you wanted the good news or the bad news first, because once again, we are faced with both. And since I thought I heard you say last time that you wanted the bad news first, that is what I will give you. All right, bad news. The United States yesterday hit the highest one-day toll of deaths for the coronavirus since the pandemic began, with 3,054 deaths in the United States in a single day. Now, what does that number mean? 3,054. All right, well, 3,054 deaths in a single day is more than the amount of 2,769 deaths, which was the previous record for the highest number of deaths on a single day since the pandemic began. It is also higher than 2,977 deaths of lives lost in 9/11. If you can believe that. 3,054 deaths in a single day is more than 2,403 deaths of the people lost at Pearl Harbor on December 7th, which was just Monday of this week. And when we think about the toll this has taken, we started with 3 dead on March 3rd of 2020. We are now 282 days later, and we are at 290,000 lives lost. That is just extraordinary to me, and it just continues to accelerate. According to the CDC, COVID-19 is now the 3rd leading cause of death in the United States. It is, you're more likely to die from COVID-19 than from accidents, respiratory diseases, stroke, Alzheimer's, diabetes, the flu or pneumonia, nephritis, I don't even know what that is, nephrosis, and suicide. And if you think about the 290,000 lives that we have lost in less than a year, it will be a year in March, you can see the other numbers there, ahead of 167,000 and so on. I wanted to just talk very briefly about, I just heard it mentioned again that the seasonal flu kills as many people. It does not. I wanted to get some facts to this. According to the CDC, the number of lives lost in a regular flu is between 12,000 and 61,000. And in the 2019-20 flu season, we lost 22,000 people. In Massachusetts, we now have 269,000 people infected and 11,166 dead. You know, it's starting to hit home a little bit more. I think all of you probably know people now, or many more people that have gotten sick. You may even know some people who have passed away from this. I just want to share very briefly 2 good friends, colleagues. I guess I can say their names, but Joe Donati, and I should say Nancy Silver Hargraves of Waltham Committee, and Nancy announced or mentioned at a recent ADP meeting that that they had lost an employee, a woman who had worked for them, in my memory, for, I think they said 10 years. And then I found out later, talking to a good friend and colleague, Deidre Hunter of JRI, that she had also worked full-time for JRI. And the toll that takes, and it just cannot be overstated, just how upsetting that has been to the organizations. We send our condolences to both WCI and JRI. Not to mention all of the lives of the individuals that have been lost. I know many organizations are suffering, and there are homes quarantined all over the state. And we are going to bring Dan Lannan on in a few minutes, and he's going to share with us how we're making out. But this is a crisis that has just exploded in the proportions of the damage it's doing to our population and to our employees. Not to mention how difficult and emotionally draining it has been for so many staff. So again, my deep sympathies to Nancy and Joe and Deirdre. Yesterday, we heard from Governor Baker, who had a press conference. He, and I'm sure most of you have heard by now, he has made the decision to move us back to phase 3, step 1. We had a little bit of had to do a little research to see how that was going to affect NuPath. We don't think it's in our reopening. We don't believe that any of the added restrictions are going to be affecting anything where we are right now. But Dan will talk about that with us when he joins us. And if you listen to that, and you can watch it on YouTube if you haven't seen it, the governor was pretty adamant that that so much of the explosion that we've seen is due to, and we haven't even seen, like, really truly the full impact of infections that were that people got from Thanksgiving. That seems likely to become more self-evident as the next couple of days go on. So that's gloomy and discouraging. But I also promised you some good news, and I believe that we do have some great news. And we, and I feel like there may be even light at the end of the tunnel, or light on the horizon. And yes, we're gonna get through this. Right now, as we speak, the FDA advisory, there's an FDA advisory panel. It is so boring. I was watching some of it a little bit this morning. And you know what? Those people are just, their Zoom meetings are just as crazy, and people have problems with technology and not being able to share their screen, just like everybody else. But they're meeting right now, this moment, to consider whether the FDA ought to give what they call an EUA, which is an emergency use authorization for the COVID-19 vaccine that's been developed by Pfizer. And I believe there will be a vote, maybe even, they said, by the end of the day after this meeting, and we may hear about it even by the end of the day or tomorrow, which is excellent news. And once that happens, we talked last week about the 2 vaccines, then Moderna will be doing some seeking an EUA probably next week. These vaccines are ready to go. The governor told us yesterday that everybody knows exactly where they're being shipped and which hospitals are getting them, and what populations are going to go first. And the state released their 3-phase plan on vaccines for the population. And we talked last week, we weren't sure exactly if we were going to be in phase 1 or if there's a phase 1A and a phase 1B, but it looks like we are going to be among the first phase of people. This is the hospital staff, doctors, nurses, and so forth, people working in congregate care, in nursing homes, and long-term care facilities, and so I would not be surprised if we have a schedule to get the first of these, the two, the series, 21 days apart. But if we might even be getting the first one before the end of December. We'll see exactly how quickly. But this is something that they are very eager to get out and get into the population. And as we talked about last week, as soon as it is right for me to do so, and as soon as it is my turn, I am going to be right there, and I am going to get this vaccine, as I know most NuPath employees will be doing as well. There's been a lot of misinformation that's out there, and we are going to try to get. We were going to have Sharon on earlier, but she was not able to join us at the last minute because she's dealing with some potential positive COVID cases in our, I believe, in our residential network. Dan will join us in a brief minute, but we feel that until the preponderance of our employees and the people we serve are vaccinated, that we are not going to be able to really consider anything like any sort of normal rhythm. And with so much spread and so many people dying in this country right now because of this terrible virus, I don't know who would refuse the opportunity. And guys, you know what? The fact that we find ourselves in phase 1, when many of our family members will likely not get the vaccine until probably, phase 3 in many cases. It's a privilege. I consider it an honor and a special privilege that we should be receiving this opportunity. And it's because of the work that we're doing. So if you're out there, you're listening, if you know other employees of NuPath that may be on the fence, I mean, I don't know exactly how it's going to go down. And Matt and Ted and those guys probably will know a little bit more. But this isn't something you're just going to put off and maybe pick up another day. I mean, if you miss this this opportunity, you may have to wait until well into the summer. And we know that this virus takes lives. We know it. We've seen it. All right. I am going to ask Dan Lannan to come online with us and to talk a little bit about a couple of things. We want to just make sure that we understand what the governor's return. Hi, Dan.
Hello.
How are you?
Doing well, thank you.
We wanted to. You told me just before we went live today that that you, after looking at it a little bit more carefully, you did not see this, added or return rollback, if you will, to a more restrictive sort of, distancing and for businesses, and some of the things they talked about were, restricting the number of, instead of 10 people at a table in a restaurant, more than 6. We're still talking about 40% of occupancy. You could go on mass.gov and you can read the specific details if you want, but we're still falling within the frame of the governor's the added restrictions, right? Because we weren't even able to get back up to an occupancy level we would have had to reduce it. Is that right? So, will you talk to us a little bit about that?
Yeah. So I guess just clarification, because people are looking at things, I think, or I've heard different things. People categorize what phase Massachusetts is in, and technically we're in phase 3, step 1. So we move back to step 1 of phase 3. Right. And so that's 40% capacity of the establishment. And so really that's, what's that mostly focused on from what we were able to to talk about through the Executive Office of Health and Human Services, as well as, the ADDP calls and DDS calls that we were on, is, that focuses on the gyms, the restaurants, the, concerts we heard, right? I didn't even know concerts were allowed to start back up, but I guess those were no longer allowed. And so, how that affects us, the guidelines we're following, set by the Executive Office of Health and Human Services and developmental disabilities, is more stringent and more strict than what BIC's guidelines are. So for us, we're more, instead of just a flat 40% of your capacity, we go by square footage, which even creates us to have less members in our locations overall than just a 40% capacity. If we went by a 40% capacity at New Boston Street or at Westford, we'd be able to serve many more people, but we're not. We're going by the square footage that they laid out to us, which is 113 square feet per individual. And so, so that's where we're at. So that's with us, that creates a good number of or a good cushion, I guess you would say, at New Boston Street location, to where even with the number of staff that we've had in one day and with the most individuals, we've still, technically could have fit, another 45 to 50 people. That's not our goal to do that. That's not what we're striving to do. Certainly we want more individuals back. And as we've had more individuals come back, we've sort of all been working these hybrid schedules. And that's certainly, allowed us to manage the number of people at New Boston Street at this point. And Westford is just not even a concern right now with the numbers of staff that we have there and individuals we have there. The capacity of that building can hold many more. So even under the EOHHS guidance, we could have had more people back there, even the more stringent. And just this may be a little bit off the beat here, but the reason why more people didn't come back is not necessarily, so it's we could have more people in, but it's not even transportation necessarily. In many cases, people have the decision has been made to keep people home out of fear that they could be infected if they leave the safety of the insular, sort of home environment where, in theory, they're kept free of COVID. Although we've had some pretty good data, don't we, for cases and exposure here in our day programs? Yeah. So, I guess 2 points to that, to what you're saying there. Our data has been pretty good. We review it weekly, and so I'll just sort of highlight what we review weekly and almost daily it's part of our conversation, but what we like to do is to put out sort of a weekly type of summary or update. Since July, since our day services opened back up, we've only had 2 individuals that have attended New Boston Street come back positive. And so certainly, and then once we started participating in the surveillance testing and the baseline testing, which happened, I think it was around the September timeframe, we have had increased positivity rates within staff, which is why the surveillance testing shows that it works, right? Because we were able to capture those staff before that were asymptomatic before they even knew they had the virus, and then limit the exposure to more people. So, but yeah, so since July, we just really only at New Boston Street had 2 individuals test positive, and in both cases, the most recent one being actually today, we get the results back today for an individual that was at New Boston Street, and everyone who had been in close contact with this individual or in their cohort has been notified, and families have been notified. And New Boston Street will go through, a deep cleaning tonight. So even as of, today, those 2 people, the both stories were almost identical. And so I guess, hearing both those stories, I'll share them. The stories were that a family member wasn't feeling good. They sent, their individual and their son or daughter in, and later that day, their test came back positive. And so then we were notified, and that's when we moved, the individual to the isolation room and Sharon tested them before they left our building, and then ultimately, a day or two later, we got their test back, and that's how we found out about our two individuals. But I mean, really, what it speaks to is that family member or the person, not pointing any fingers, but what we want to really do is, if someone's not feeling good, if someone's not feeling well, or has a cold in your family, I think it's in the best interest to take a day or two off, and that that will limit the risk of more people becoming sick if possible, but also too it will, if the person's test comes back negative, then it will expedite their return to program too. And so I just think I think everyone's trying to do staff, certainly staff-wise, staff at our residential homes and day services have been incredible. And the families, the conversations that are happening with families on a daily basis have been so positive. And so we think the guidelines and the system we have set up with having the two positive results since July is pretty good. If we can tighten it even better, we will. We'll review that tomorrow morning. But we'll just continue.
It's actually fantastic if you think about the number of people that have been through here and just have two positive cases, comparatively speaking to residential programs that we know, and we talked about it last week, that all up through Region 3, up to Cape Ann, there's been a huge surge in the number of cases, in fact, across the whole state, as we see the numbers climbing. If you're looking strictly at the data, one might even argue that the safest place you could be is in the day programs.
Right.
As far as being less likely to be exposed. Now, whether that has to do with the fact that you have fewer staff coming in. I mean, in residential programs, you typically have 3 different shifts that will rotate through, and those people, they go off to their own lives and weekends and maybe second jobs and so forth, whereas in the day services, you have fewer staff that rotate through. So there's lots of ways to kind of look at it, as to why that would be. But from the perspective of our commitment to safety and our commitment to the health and well-being of the people that are here, I feel like we've actually, knocked wood. I'm sure Sharon's like, going crazy. I know she doesn't like me to say things and jinx ourselves, but for the time being, that's been a good thing. And you and I have been talking about and we'll go to the vaccine in a minute. I'll let you finish talking about the update, but you and I were talking about how, or maybe I was talking, you were listening, but getting the vaccine is got to be our #1 priority, and it's got to be what we just urge every employee and every person served at NuPath to do, and to do as soon as it becomes available, because that is going to allow people that have been trapped in their homes since March, in some cases. I'm not saying they don't get out at all, but I mean, I remember when we were doing the working from home and some of that stuff for a few months, I was going nuts. And I can only imagine what people, and then there's the fear that comes from not going out into your regular routines and into the big scary world, and that could have a life of its own. And I think we're gonna have some work to do, but I'm just so excited to just the thought of once we, if people are vaccinated, then they can come into the space, or these safe spaces where everybody within the 4 walls have been vaccinated. And I'm just seeing that as being an essential beginning of our return to some sort of a normal life, maybe even by mid 2021. Certainly an optimistic development and a very hopeful one. At a time, it couldn't have come at a better time. I was talking yesterday to a group of people from ADDP, and I just said, can you imagine what we'd all be feeling if there wasn't, this vaccine in the works, if they still hadn't found one? I mean, knowing that we're going through this very bleak and terrible time with the number of increased cases and increase in deaths that will surely follow was a lagging indicator. But can you continue talking about the cases and just so that people know like where we are now?
Sure. So, I think the clearest way I think we want to look at it, and even talking about those 2 cases, since July in the recent event of today, I think we have done a good job, and I think that speaks to the extraordinary work our staff have done in following, the proper guidelines, wearing masks, washing hands, keeping just 6 feet distance. I also think that speaks to the parents erring on the side of caution when someone's not feeling well. They call, they communicate to us. You know what I mean? If they request a test, Sharon and her team have been able to test, the individuals. And if they're not feeling well, they've kept people home and just said, I'm going to wait to see. I'm going to wait and see. And I think that just speaks to the efforts that everyone has put in. But so to continue with, so from the week of 11:30 to 12:06, right? We've been doing, what we did is we increased our testing at the day facility program to every week. So staff are being tested every week, even though the recommendation is bi-weekly. We increased it to every week for day program staff. And so the week of 11:30 to 12:06, we tested 171 staff. We had 3 positives out of those 171 tests. So that gave us about a 1.7 positivity rate. Now for the fast forward for the week
which is
of
low, which is pretty low. We want below,
right, which is extremely low, and that's what I was going to sort of recap at the end. So during the week of 12/7 to basically until today, 12/10, we've tested 92 staff at this point, and with 2 positive returns, which is a positivity rate of just about 2%. And so I think what we're seeing is not a dramatic spike like, statewide numbers, but the more we're testing, the more positives we're having, but that's good because that's closer to capturing it so that it doesn't, spread and more people get sick. And so I think we'll just continue to track those numbers and watch what those numbers tell us, what percentage of the tests we're giving. And, today's numbers didn't include all the tests we've done this week. And so certainly, as of say noon today, that was the most current information I had. And so I think, I think the feedback has been tremendous from families about attending programs and the things and the energy that individuals have had coming into programs and just how happy people are to be returning. So we don't want to lose that. And so, when you're talking about the vaccine and the hopefulness that's on the way, what we can just focus on now is doing, following all the guidelines that we've set up, working with families, continuing to communicate, refreshing people of all the guidelines, like the continued, like we did back in September and August, where we had low positivity rates, but we kept talking about wearing a mask and pointing out, opportunities that we didn't see people wear masks. We just want to, stay vigilant, so that we can continue to offer, the day services and offer the services just across the board, because I do believe that, you were just touching on it. The mental health angle of this is just as important as the physical health of it.
I was going to just take an opportunity to all of our staff that are listening, just to thank them again for their perseverance, for their attending to the guidance that's been issued. That it's not fun wearing a mask for 8 hours of your shift. I know it's a painful thing to have to keep it on. All of the the hygiene related social distancing. In some cases, their staff are working with folks that are maybe not very cooperative. They don't want to wear the mask. Maybe they even have some response to it that could be difficult or challenging to manage. And the beginning, when this whole thing sort of emerged in March, April, when we closed down, it was scary because we didn't know what any of it was. Now we have the vaccine in sight, but it's the pandemic fatigue that I've been, hearing it referred to, where it's just, and I know that our staff in the trenches on the front lines, day in, day out, and many of our staff are working other jobs and constantly having to be tested. It's a tremendous strain, and I want to just remind them all what they've probably been hearing in the news: just hang on a little longer. We've come this far, and we can't give up now or stop abiding by any of these things that we know are proven to work. So that's just a big shout out to you and your team, operations, really the whole organization. What am I saying? But people that are working directly with the people we support, I think have it the hardest. And our residential teams that just haven't missed a beat. Kudos to them.
I know that you and I talked a little bit yesterday, and in talking with some people this morning, it always goes back to the positive work and the efforts that staff have made and managers and directors and so many people just filling different roles and doing different things. It's been outstanding and so humbling to me. And I think the term you were looking for, the term we used yesterday, was the COVID exhaustion. And so, and I do believe that to be true. And I think that I think the best thing is to do, for those individuals that families don't feel comfortable to come into the programs and aren't ready to, to be in the programs, to just stay engaged with the telehealth. You know what I mean? And join the Zoom classes and the remote classes, because, I've seen a couple of those. I've seen the schedules. They're changing those all the time. They're incorporating new things. And I know that is what we talked about this morning as far as keeping it fresh for these 6 to 8 weeks that everyone keeps talking about. It seems like everyone keeps saying 6 to 8 weeks, and yet haven't given us what the start point is of those 6 to 8 weeks. So those 8 weeks will turn into 12. But really,
well, President-elect Biden has talked about this 100 days of mask wearing. It's not forever, he said, but let's really hunker down and do what we got to do and eliminate the community spread. And so you and I were talking about, well, that put us to April 15th or thereabouts. By then, are we gonna? But when does the 100-day start? The counting is I think your point that how long is this gonna drag on?
I just think that my opinion, and we talk about this all the time, is we have to work within the guidelines we have and do what we know how to do, which is deliver services to the individuals and the families we support to keep their spirits up and their energy high, and we have to do that with staff equally as well. And I think that it's tough to do right now because you can't get together, you can't do some of the normal things you would do to try to engage with people. And so we're just trying, that's why it's so key to just to stay in contact with people, keep talking with people, keep seeing people on the Zooms and telehealth and staying engaged. And I know, you were talking about a couple of other providers that don't feel comfortable having individuals turn to day programs because they think the risk is there of, them being exposed to greater staff, therefore having a greater risk of testing positive, of picking up COVID. And, we're just working directly with those houses to just say, yes, but there's a greater risk that this individual isn't engaged in anything, during the day, and they need to be engaged. And so that's what we're just continuing to try to do, is try to engage people.
Right. Because I think that when this is all over, there's going to be an adjustment of going back to public spaces and to, more, crowded environments that we probably don't even know the full impact yet, as far as, I'm sure there's a lot of people, not just in NuPath, but across the world that say that have been, doing so much, in these insular, little environments and working from home and so forth. And once, the vaccine's widely available and, let's just hope that we're able to eradicate or really, bang this virus back. There may be a period of adjustment where, whether you're a staff or a person served, it may be a little awkward at first to try to return and thinking, I'd much rather, I could stay home, I could stay in my sweats or my pajamas. I don't want to have to, but I think people will agree that in most cases, it's good that people are able to see different faces and to have different kinds of communities and peer groups and opportunities, that you probably don't get if you're wearing, old sweats and house slippers, all day long, and not getting out. So, we're not going to get into it in depth now because it'd be a conversation for another day. But on Tuesday, ADDP invited Jane Ryder, the commissioner, on, as well as Whitney from DMA, to talk about some changes to the day services and day habs and the community-based day supports programs, and have really seen this pandemic as being an opportunity to kind of reevaluate, the old sort of standard model that everybody gets in their vans and goes to work every day, and then at 9 and they come back at 3, sort of thing. And there might be a way to look at doing a mixture, even when this virus is gone, pandemic is over, that this is introduce some different ways of thinking about people served, and we're excited about that, aren't we, Dan? Because we're already doing a lot of that stuff with our No Walls programs, and it feels like this could be just another a way that we can really help to customize the day service kind of paradigm or opportunity for just a wide population. That's what we're good at. We're having a very customized approach. So we're going to be ready to go once we get the green light.
Yeah, I think it couldn't speak to what we sort of pride ourselves on trying to do, which is to be part of the community. You know what I mean? To be active in the community. And so our No Walls groups are perfect examples of that. The number of No Walls groups we have and the excitement the families that participate in No Walls group have, because they had some input into what services they'd like to see and things they would like to do, and the individuals had that. And I think that this is an opportunity that is going to allow day hab individuals and families to be able to do that too. And the flexibility that it could provide is just so beneficial to individuals, And so I think anytime you put a guidelines on services and boxes on services, and you have to fit within that little box, well, not everyone wants to fit in that little box. And so we're trying to make sure that we can meet the needs of people, but also be able to try these new things that people would like to do, because some of them we have in the past, and they've been enhancements to the program that we've offered to more. And so, I think it's a good, some good could come from all this, all this pain that we've had to all go through and endure.
Yeah. Well, yeah, maybe. Yeah. Some good will come of it. We've learned a lot. We've learned a lot about what we're capable of doing and what we could do remotely, what we could do without, what we never thought we could. Dan, in the couple minutes that we have left, and we're not going to go deeply into this topic either, but, on top of, the stress and anxiety around, the potential spread of this virus, of us getting it, of our family members getting it, it's no secret, we've talked about it here, that NuPath, as well as many, many, many other organizations in this industry, in fact, most, are struggling financially, like in a way that I never, ever thought I would see in my experience at NuPath. We've had to lay people off and furlough people and do things that has caused an additional layer of pain and agony, on top of the pandemic fatigue and exhaustion that people are feeling. You and I both, and many members of the team, have taken a 20% cuts in our salaries. And you and I were kind of kidding around. I said, I sometimes get those coupons for 20% off at Bed Bath & Beyond in the mail, and I'm never gonna look at those 20% coupons the same way, because boy, I realize now how much off that's going to be. When it happens to you. But a future where things can only really begin to return to normal once once the vaccine's widely distributed, and once we get people back and we can get our staff out doing the things that we're good at, and that brought us into this field into the first place, and that we're very proud of, that's part of our mission. And I feel like it's been a particularly painful thing for me to see this kind of dismantling of so many of those, sort of special enhancements that I feel like is our sort of claim to fame, or something that we're very proud of. All these things that we work so hard to achieve, and to see them stripped away because we could either, because of the social distancing, the guidance, or just the lack of money, not able to do. So it's, again, just to acknowledge to the staff how I know it's been difficult, and there's been pain has been spread around, and just to thank people for their endurance and sticking by it, because even in spite of it, there's been this, I've just seen such extraordinary teamwork, and I have to believe that our mission and our core values have been things that have helped to sustain us. I mean, when I think about the things that people are doing, from the the remote learning and just the ways people are kind of coming together to support the organization through this is just pretty incredible. Yeah.
I think people will be hesitant to rush back into, like you said, larger crowds and maybe some certain things. But I think if I know for myself that if the opportunity or the event is worthwhile, I'll make the effort to go. You know what I mean? And so that's what we're going to focus on, is trying to make sure that the program and the activities and the things that we can offer when we're out of this and we do all have the vaccine and getting back to normal, is that we can offer some really exciting, intensive, get-togethers, programming, carnival-like atmosphere.
Kickball tournaments. We talked about, like, let's get our calendar for the spring and summer packed full of just great, fun, energetic things that people love, and start to put it out there so that people can begin to look forward to it. You can remember a time before this all happened when it was all right to go up to their friends and give them a high five, or shake their hand, or give them a hug if they wanted. Those days will come back. I'm more convinced now than ever. It's just, we just have to hold on a little longer.
Right.
Well,
right.
Dan, once again, you're running all of the operations for the organization. You've got a really tough task, but I know you've got great people on your team. We're just so grateful for your steady hand and sometimes some unsteady waters. So
I'm just so great. Everyone's just been so supportive of the staff. The staff, even that I don't have a chance to talk with directly, but from the feedback from the managers and directors, and even working with just all different facets of NuPath. The finance department and administration, just because our supports that operations need are quite a bit different than the support we needed, before the pandemic. And so, and that support allows us to be this, responsive, I think. And so, so we're just plug along and can control what we can control. That's the biggest thing we can do, so.
Well, Daniel, thank you so much for your time today. Thanks for being part of NuPath Live. And if you have staff that aren't watching this today, just pass along my appreciation in case they didn't.
Yes, I will. All right. Take care. Thank you.
Okay. Bye-bye.
Thanks. Bye-bye.
All right. Well, there you have it. That's what we know so far. And you guys will be the first to know when we get that call. I wonder if I should wear a tank top that day, just so it's really easy to kind of get my arm out. And kidding, I'm not going to wear a tank top. But I am going to get the vaccine with deep humility and appreciation for being so fortunate to be part of the phase 1 trials. And so it's been a tough couple of weeks. I'll be honest with you. There's been a couple of times I just felt this sort of melancholy, and I think it is the fatigue of it all. Just the worry about this organization, and I love NuPath more than I can possibly say, and I've said to people before, there is almost nothing I would not do to ensure the the solvency and the health and the wellness and the security of our staff and the people served. And I know I'm not that important that I can't control it all, but sometimes I feel like I should be doing more. But that's a feeling that I know a lot of people have. But we've got good news, and I hope you are all excited along with me, because I don't want to hear that we're got a bunch of people that are not sure if they want to get it, because if they miss this turn, you may have to wait a long time, and well, we'll save that conversation for another day. Right now, we're just going to end on a happy note. So continue, please, to wear your masks. Reevaluate your Christmas plans, your holiday plans, your Hanukkah plans. Maybe you don't need to get together with big groups of people. Just a few more weeks, guys. A few more weeks, please. Let's all stay healthy, and 2021 will be much better. We got this. All right. Talk to you later. Bye-bye.